morning, members of the jury. We did our best to try to present the case as quickly and as efficiently as we could, like we said during jury selection. There's over 1,000 pages of medical records. Now, we don't expect you, I certainly don't expect you guys to leaf through it. So what I want to do is just highlight a couple of pages, and you can have the closings read back so that you can get the page number if you want to see the documents. But it's important for me to show you a paper trail of what occurred, because Mr. Cuthbertson, who's a heck of an adversary, was saying this case is prone to exaggeration. Did anyone get the feeling that Marie was exaggerating her claims? You don't fake this kind of a significant injury. So in Exhibit 1, the hospital record, right from the admission, plaintiff tripped on a screw sticking out of the brick, given morphine, acute pain, knee dislocation, August 23rd, 2016. Okay, so there's no question that that's what happened. The left knee, obvious deformity. Pain also and tenderness to the left hip. The left hip, consistent with the left knee. Nothing with the right hip. Okay? The right hip was related sequela because she walked with a cane. But again, not exaggerating. She's 53 years old, female patient with the left knee dislocation. 53 years old. That's prime of lifetime. X-rays. X-rays to the left hip. Patient with knee dislocation needs to go to OR for application of the left knee external fixator and pain control. Okay, this is the paper trail of what happened. Remember, clever lawyering is not evidence. Okay, all this business about pre-existing stuff is a fiction. It's clever lawyering. It's not in the medical records. Plaintiff's French speaking. They immobilized the leg with a knee brace. She has her first surgery under general anesthesia. The preoperative diagnosis and the postoperative diagnosis are always the same. Okay, they're always the same. Counsel tried to cross Dr. Munn that as if there was something, well, she had degenerative something or other arthritis beforehand, she's got degenerative osteoarthritis afterwards, as if that's significant. It's not significant, it's clever lawyering. The preoperative procedure diagnosis, in this case, left anterior medial knee dislocation. Postoperative is the same. It's always the same, okay? General anesthesia, Dr. Quella. We heard all this. I'm just highlighting what's in the batch of 1,000 records so you can pull out, well, did that really happen? This surgery was done on August 23rd, 2016, the date of the accident. The interpreter in Creole. Okay, this lady didn't speak English. This lady would never tell a hospital, yeah, English is my preferred language. Anesthesia was administered. The patient had an LCL tear and possible ACL and PCL tears. You may recall the doctors educated us, those are the ligaments, okay? She had the multi-ligamentous, sorry. She had the multi-ligamentous injury as part of the knee dislocation. It's one and the same, it was traumatically induced. That's the first and only time she had ligament damage, period. That's the only thing in the records. She was transferred to XL on August 30th, okay? We know she went into XL on August 30th. There's a note, they attempted to clarify, the case manager attempted to clarify with plaintiff's daughter, Jenny. Jenny states she would like to take her home. This was on September 30th. Come on, I want mom home. I want her home already. She's miserable, I gotta get her home. No, Jenny, it's way too soon. She wasn't sent home until October 31st, over a month later. But Jenny is a Mensheva daughter. Her heart's in the right place. She wants to take care of her mom. Did you get the sense that Jenny was exaggerating? She was not exaggerating. September 30th, she had the removal of the external fixator. Again, in general anesthesia. These external fixators is a big deal, folks. They drill a hole right into the bone. That wound site alone is painful, significantly. Both doctors admitted it. They placed the leg completely straight. Imagine having your leg throbbing in pain for months at a time. You know, we say in our business, a serious injury is when it happens to us. A non-serious injury is when it happens to someone else. Ah, 500,000. Come on, that's crazy enough. Okay, let's talk further about the documents. She goes to Nassau University Medical Center for follow-ups. There's a series of follow-ups. She arrives in a wheelchair with a hinge brace knee locked in full extension. That's what she said. She was in wheelchairs. Now, this is very significant. One of the follow-ups at Nassau University Medical Center, the chief complaints of pain, 54-year-old female, left knee dislocation with multi-ligamentous injury on 8/23/16. It's right here in the records. She didn't have pre-existing ligament damage. It is a fiction. It is clever lawyering. There's no evidence in front of you. There can be no evidence. It's a non-event. And the note that he's trying to hang his book on, trying to hang his hat on, I should say, is that, oh, she was in Jamaica many years ago and had a multi-ligamentous injury and never treated. Really? She said she never went to Jamaica. She testified at 2 depositions and was asked questions. Don't you think if she lied at the deposition and said something different than what I proffered in front of you folks,
Objection, Your
he
Honor.
would have cross-examined her on it? The daughter said they never
There's
went.
an objection.
Oh, I'm sorry.
The depositions didn't come into evidence and testimony about it's not proper.
Okay, I'm sorry. I didn't hear the objection. I'm so sorry. The daughter said she never went to Jamaica. She lived with her mom her entire life. So I submit this whole business with Jamaica and pre-existing is nonsense. It's a pure fiction. Another very significant thing to point out, July of 2017, she goes back for follow-ups at Nassau Medical Center. Patient is status post-dislocation of the knee, now complains of pain associated with osteoarthritis of the knee. Patient would likely benefit more from a TKA than ligamentous reconstruction. Now complains for the first time. Now complains. This is not a pre-existing ligament injury. It is a fiction. It's not true. It's right here in the medical records. Exhibit 3, page 74. Exhibit 3, page 79, an impression, it says mild tricompartmental osteoarthritis. Mild, with all the chondromalacia and all the other fancy medical terms. Mild. This is not some ticking time bomb leg that's about to dislocate and if you step on a thumbtack, okay? This injury was directly caused from her tripping and crashing down on the cement in a freaky twisting accident, just like the doctor said. In fact, Dr. Munn said that it was such a rare event, these dislocations are so rare, 0.2%. 0.2%. It means 99.8% of the time there's knee dislocations, it's not from a trauma. It's so rare. Now let's talk about the witnesses. I tried to highlight the documents. Dr. Munn, we can all agree, very nice young man. First time ever in court. He was a little bit nervous, right? But he was here to testify for his patient. God bless him. That's nice. And he's her treating doctor, he said, for life. The first visit, July 23rd of 2016, he said, Marie, let's try conservative treatment. Let's see how you do. Council tried to have us believe that there's some mill with TV commercials and they pound them out one at a time with surgery and they do thousands. That's not the case. This is an ethical medical orthopedic surgeon. Let's try conservative treatment. I even said, Dr. Munn, if the conservative treatment would have worked, would that have avoided knee replacement surgery? He said, yes, but it was inevitable. It was unavoidable. And she didn't want the surgery. She was desperately afraid of the surgery. Who wouldn't be? So they did conservative treatment. He re-upped more PT, painful PT. Squatting, presses, painful if you've ever been through it. Gave her injections, steroid injections to alleviate the pain. Of course, she got some relief, but not enough. He had a few more follow-ups. Another one in August, another one in November. And the November one, Marie, you have no choice. You're gonna need the TKA. So they scheduled it, December 19th, 2023. This was inevitable, but the surgery was a success. She was 100% disabled before the accident, and she was 75% disabled after, with some range of motion still improving. By his standards, that was a success. I said, Dr. Finkel, was the surgery a success? He said yes. Both doctors agreed it was a success. Dr. Munn said her prognosis is guarded. She's likely going to need future revision surgery to replace the apparatus, the knee apparatus, which has a shelf life. He said that future surgery is going to be very painful, very debilitating, a long recovery, especially because she's aging. Uncontroverted evidence, doctor, if that surgery were today, how much would it cost? He said $100,000. You can assume that it was the same number when he did it in December of 2023. Both doctors agreed this is not the end of the road for Marie. Both doctors. And why is that significant? Because counsel in his opening tried to wrap the American flag around Dr. Finkel as if he wouldn't come here with an agenda, okay? And he wouldn't come here and essentially lie to you. Okay, so let's look at what he said. He hasn't performed surgery in 18 years, right? He's 81 years old. He looked great. Sorry for the bruise on his eye, but he looked great. He stopped surgery when he was 63. So for 18 years, he's out of the OR. I'll bet on Dr. Munn with his 4 years of surgery in the trenches over somebody where when Dr. Finkel was around, they didn't even have robotics. The technology totally changed. He confirmed Marie Sannon had a serious injury. That's what he said. She had a left dislocated caused from the trauma from this fall on the concrete. He said it, Dr. Munn said it, we all said it. The verdict sheet, the first question is going to say, did this accident approximately cause the injuries? You must answer it yes. Okay, that's the easy part of the verdict. Dr. Finkel said that everything that they did in the emergency room at Good Sam was done correctly. Closed reduction surgery with the placement of the external fixators under general anesthesia, which carries certain risks. He said there was difficult PT, physical therapy, and post-op, and he agreed it was painful, exquisitely painful. He agreed she had removal of the external fixator, yet another surgery, also under general anesthesia, another round of painful PT. He agreed it was painful. He could not and did not challenge the qualifications of any of Marie's treating doctors. Okay? He couldn't, and he didn't. He confirmed that the total knee arthroplasty, what we've been referring to as TKA, was indicated in the emergency room records, and it was inevitable. Dr. Finkel, you reviewed all the records as well, just like Dr. Munn. He goes, well, it's not practical to review all the records, but I certainly reviewed the ER records. And I asked him, wasn't the TKA anticipated? And he said yes. Now, Dr. Finkel knows Dr. Munn. He agreed with his findings. He added that the surgery was a success. And then there was this issue about whether Dr. Munn intentionally didn't resurface the patella due to poor bone quality and inadequate thickness. That's in Dr. Munn's report. So in Dr. Finkel's report, he said, well, the only thing I question is that he didn't resurface the patella. And I said, well, Dr. Finkel, in your own practice, aren't there risks if the bone is thin? Remember, I correctly said cartilage. He said, you mean the bone? I said, right, I'm sorry, the bone. Right, because it could fracture. So I said, are you in a better position to evaluate Marie than her own Dr. Munn, who's performing the surgery? So he made a good medical judgment. Now, Dr. Finkel agreed that her extension, the range of motion, got to 120 degrees from 110 degrees. That's a minor win. Okay, normal is 140. So if you're 110 and you can go to 120, you're on your way, but it'll never get to normal. He agreed it was painful. Dr. Finkel agreed Marie's in pain every single day, and she's been in pain every single day since August 23rd of 2016 to right now, and she's going to be in pain for the next 22 years of her life expectancy, as the judge is going to inform you. She's going to have pain and suffering for the rest of her life. Dr. Finkel also agreed she's going to need future surgery. That's number 4. That's a 4th surgery. He goes, well, I wouldn't necessarily do knee revision surgery. Maybe I would do some patella reconstruction or ligament reconstruction or some other surgery. But he said, she's going to need a 4th surgery. Well, that's a pretty big enchilada, Doc, don't you agree? He goes, yeah, this is a serious situation. And she's going to have PT, and that's painful and very difficult given her ages. Now let's look at Dr. Finkel's bias here, okay? He was paid by the defense of this litigation to come to court, right? He said $7 grand. He was paid $400 an hour to review records, but couldn't tell us how many hours. Really, Doc? You couldn't tell us? You don't have an idea of what you charged? What you're gonna, whatever. To me, that's very disingenuous. That right away there, sorry, I'm waving the flag on that one. When I asked to look at his folder, okay, I'm permitted, judge certainly permitted, no objection. I leaf through it, and lo and behold, Exhibit 11, a note. Defense attorney told him to revise the report. And then he did the cha-cha. Well, he changed the anatomical thing, okay? A defense attorney who can barely pronounce the medical terminology, just like any of us can't, is going to tell this 81-year-old chief of staff expert what the anatomical changes are. Oh, doctor, you said it was lateral, it should be medial. Come on, okay? It's extremely improper and highly questionable, to say the least, for an attorney to tell a doctor to revise it, okay? So when you want to talk about you make a mistake, you own it, and you want to try to throw some shade on Dr. Munn, let's keep it real, folks, okay? We said in jury selection we'll call balls and strikes, okay? That's ridiculous. But now let's talk about what Dr. Finkel didn't say. Dr. Finkel never gave an opinion to contradict the causation. He never said, in my medical opinion, this was not caused from the trauma of the fall. He never contradicted the diagnosis, the left knee dislocation and the ligament damage. He never contradicted the injuries or the related sequela. Doctor, in your experience with your own patients, don't they make compensation? When you're walking with a limp, doesn't that hurt your lower back and affect your right hip? Okay? We never said she's going to need right hip replacement. In fact, we brought out that she doesn't need it, will not need it, never had it. Oh, there's an error in Munn's mistake. We saw an x-ray of the right hip and it said that the hardware is still in place. That's a mistake, Munn said. I asked Marie, did you ever have right hip replacement? No, she didn't. Again, it's clever lawyering. Clever lawyering is not evidence. Clever lawyers deflect and distract. Dr. Finkel never gave an opinion as to the pain and suffering or the lack of pain and suffering. Get this, he never gave an opinion as to the permanence of the injury. One way or the other. He didn't say it's permanent, it's not permanent. He never gave an opinion as to the percentage of disability. Dr. Munn said she was 100% disabled. Now she's 75%. That's uncontroverted. Don't you think if the doctor had something different to say about Dr. Munn, he would have said it on the meat and potato issues before the jury? And he didn't. It's game over. Okay, it's game over on the plaintiff's proof. So the defendants have offered nothing to refute our claims. So now you got nothing, you pound the table. Well, she's got some congenital that might predispose her to dislocate her knee. It might. Really? Dr. Munn, would she have dislocated this knee if she didn't crash to the cement? No. Dr. Finkel, would she have dislocated this knee if she didn't crash on the pavement? No. So I think all this pre-existing degenerative, it's all a smokescreen. It should be disregarded, and you folks have the power to disregard it. Okay? You can accept or reject whatever is before you. Listen closely to the instructions that the judge is going to give us in a little bit. This genetic issue of trochlear, even if it was genetic, it doesn't relieve the defendants of their obligation to pay for it. We all said, you break it, you pay for it. That's the rule we live by in society. That's it. Okay? They don't score any points if she had a congenital predisposition, which we say is a bunch of nonsense. But even if she did, there's no aggravation of a pre-existing injury because there was no pre-existing injury. It's a smokescreen, and you're free to reject it. She was 53 years old and healthy and strong. Now let's talk about Marie. Timid lady, hardworking, nobody can refute that. 2 full-time jobs, work 7 days a week. This is old school. I'm coming here, I'm gonna buy a house, I'm gonna live with my family, I'm gonna teach them right from wrong. Okay? This is a high-quality individual. Did any of you get the feeling that she was exaggerating? Okay? Anybody? She wasn't exaggerating. In fact, she was quite credible. If she was exaggerating, she would be a malingerer. She wouldn't try to go back to work the very minute she's medically cleared on May 23rd of 2017. And she goes back to work and she's looking for her supervisors so she could sit and catch some breaks. Did you think of an American Disability Act violation? Did you go talk to a lawyer and sue because they didn't make accommodations? No, she never thought of it because she's not litigious. Okay? This is a very credible individual. And it's not an issue that she was let go and put out on short-term disability. Just have a couple more documents to go through, and we'll get to some numbers. Physical therapy at Palermo. Her chief complaint, she can't walk, she can't bend the knee. Oxycodone. She's on pain meds. Some way to live. Palermo. Copays. She said she had copays. It's in evidence. $1,720 is what she paid. Not exaggerating. She stopped treating in 2018 when she could no longer afford it. Isn't that real? Isn't that just keeping it real? They make it sound like, oh, there's this huge gap in treatment, therefore she's full of it. Well, let's talk about the gap in treatment. She stops treating in 2018 because she could no longer afford it. 2019, her husband dies. She was quite dignified, didn't expand. She wasn't trying to tug on anyone's purse strings or emotional strings. She was keeping it real. And I kept it real for you people. Okay? Then we all were affected with COVID. She even said through the interpreter that, yeah, well, due to coronavirus, we couldn't leave our homes. If she was a malingerer, she would treat. Okay? She'd be running up the tab. Instead, she did her home exercises and just stayed at home in misery. The operative report of Dr. Munn, I just want to point out, preoperative diagnosis, left knee degenerative joint disease, postoperative diagnosis, left knee degenerative joint disease. It's the same. Anesthesia, spinal, with sedation. Exactly what Dr. Munn testified to. It's Exhibit 6. The patella was not resurfaced in this case due to poor bone quality and inadequate thickness. Okay? I only highlight that because the documents are consistent with the testimony. Dr. Munn didn't have an agenda. He's here medically for his patient. So to me, he scores extra points. Now, let's talk about her work. Exhibit 7 are all the Linzer records, okay? She worked as a home health aide as well, for People Care. She gave Linzer as a reference. This was not some secret separate job. She was totally transparent. People Care is asking for work-related, she's a factory worker, and give us a reference with Linzer. So Linzer gives her the highest scores. It's good, fair, or poor. Everyone is good. And it was faxed over from Linzer to People Care. Linzer verified it. She's a factory worker. Okay? So there isn't a shred of proof that she did home health care. It's clever lawyering. It's pure baloney. There's much more than a shred of proof. There's documentary proof that she worked for People Care, and there's testimonial proof that she worked for People Care. Yes, I worked for People Care and I got paid $11 an hour. Jenny, did your mom work? Yeah, she worked 2 jobs. She worked as a factory worker for Linzer, and she was a home health aide for People Care. She's been a home health aide for a long time. Okay, that's a very trusted position. Even before People Care, she worked for Bayshore Home. It's in the records. From 2014, they too asked Linzer for a reference, and it was disclosed. So I submit that Marie, not only was she a model employee at Linzer, but it was totally disclosed. They even knew she's working 7 days a week. You know, there's an expression, you want something done, you give it to a busy person. This lady really sacrificed herself. Now, she was under the care of doctors and was trying to get medical clearance to go back to work. This business of, oh, she didn't go back to work, she could have gone back to work, you know, has a sedentary job, right. Go give a lady with a cane that doesn't speak English a job to do sitting. Doing what? As a home care of a patient where you can't lift and turn? What if the patient fell? Now you got a double emergency. It's irresponsible. So what's she gonna do? Sit and be a receptionist? How's that work when you don't speak English? And Jenny said it. Well, find a job and we'll go pursue it. It's not a situation where she doesn't want to work. She would give it all back to not be injured and live her life happy and enjoy her 3 grandkids. Who wouldn't? So she gets medical clearance finally. She was seen at a follow-up visit on April 17, 2017. She may return to work May 23rd, no prolonged standing, no deep squats, no lifting greater than 20 pounds. So she may go back to work May 23rd. Okay? What does she do? She goes back to work May 23rd that very minute. It couldn't have come soon enough. If she was a malingerer, she'd say, you know what? I'm on Easy Street. The cake's in the oven. I'm building up this case. Come on. That's not what happened here at all. Linzer product. Exhibit 7, page 83, New York State. Her rate is $10 an hour. Okay? There isn't a shred of proof. Not only is there a shred of proof, but the defense counsels were provided it. Okay? Prior to Mark's office, there was a prior firm representing the town, and we gave them authorizations to release the employment records. So they got all their records. The defendant's got all the records. It's Exhibit 7. And in the records, they did a run, and it shows gross pay $47,313.63, which is a total run from the last couple of years. I used simple math. $10 an hour, 40 hours a week is $400 a week, is $21,000 a year. Okay? That's what she earned at Lindsay. At People Care, she got paid $11 an hour. 12 hours a day is $132. And Sunday, every other, so we did it at 6 hours rather than 12, at $66. So it's $200 a weekend.